being a medical officer in CSC, how will you arrange vaccination drive? Now, personal question from you. How are you feeling with PD classes? कैसा लग रहा है आपको हमारे साथ?
Sir, it is very good, sir. I really love to attend your classes. I have noticed that I have changes a lot after attending this class.
Okay.
I can speak, actually improve my language skill, and I can answer it. If I attend to 3 or more classes, I can able to answer very well. It boosted my confidence.
This time we would have made a record that whomsoever have gone our student, they have cracked the interviews. But unfortunately, one of my student has suffered from dengue. Very intelligent surgeon he was, very intelligent. And he was from Pune, I think. First of all, you tell me about your strengths, your strong points.
My strengths, I am a well-dedicated, hardworking and disciplined person, and I am very competitive, and I love to have new challenges in my life.
Okay. And today, whatever question being asked by AMC, I'm going to ask these questions with you. Okay. So first of all, you tell me about malarial management. You don't write anything, I'll give you questions. Don't worry.
Malarial management, it is based on which plasmodium that cause infection.
Okay.
It is usually done by smear examination. And if it is due to Plasmodium vivax, there we will give chloroquine to the patient. In pregnancy also we give chloroquine. If it is due to Plasmodium falciparum, we give artemisinin based regimen is given. And but in pregnancy it is contraindicated. We give quinine for the pregnant ladies. Then if it is due to Plasmodium malariae, then chloroquine is given.
Okay, you tell me about your experience of working.
I was very active in my internment period, and after that I have a salubrious experience of working as medical officer in government medical college.
Tell me about pneumothorax, breathing pneumothorax.
Okay, sir. Pneumothorax. It is an emergency, life-threatening situation, and there will be entrapping of air in the pleural space. This air will be there is only one-way valve, and there is entry of air happens, and there is no outway going of the air. So this space will enlarges and it will shift the lung, and it will lead to the collapse of lung, and death will happen. And the most common symptoms are there will be pain in the chest, and there will be deviation of the trachea. And we can, investigation is X-ray. When in X-ray, we can see the deviation of the trachea, deviation of lungs, and it will pull the superior vena cava or inferior vena cava, and it will cause circulatory discomfort and hypotension, shock will happen, and venous pooling also happen. The treatment is intercostal drainage. Is done in the 50 intercostal space.
Okay. Today, one of our students was asked about the role of medical officer. Tell about this.
Okay, sir. Role of medical officer. The main duty of the medical officer to attend in a outpatient department. Then there will be organizing of universal immunization schedule, then national health programs, then maintenance of cold chain such as iceland, refrigerator, deep freezer, vaccine carrier, etc. Then monitor the vaccine while monitoring. Then we should organize the ASHA workers, med-auxiliary wives regarding the management and
okay. You tell me about vaccination schedule then.
Vaccination schedule. In Kerala, in India, we are following the national immunization schedule. It is also known as the Mission Indradhanush, which was launched in 2014. And according to it, at birth, we are given BCG vaccine, then oral polio vaccine, 0th dose, and hepatitis B vaccine is given. And at 6th week, we give oral polio vaccine, the first dose, then pentavalent vaccine, and it includes the vaccines for diphtheria, pertussis, tetanus, then Haemophilus influenza and hepatitis B. Then rotavirus vaccine first dose is given. Then in the 10th week, we give the oral polio vaccine second dose, and then IPV, then pentavalent second dose, and okay, then in the 14th week, we give oral polio vaccine third dose, IPV, and pentavalent vaccine third dose, and rotavirus vaccine second dose. Then it is in the 9th month that we give measles vaccination, and along with that, sometimes we give Japanese encephalitis vaccine in the disease-prone areas. Then we give vitamin A, oral vitamin A is given. It is given if less than 1 year, the child is given 1 lakh international unit, and if the child is more than 1 year, it is given 2 lakh international unit. It is given every 6 months thereafter, after 9 months. Then at 5 years, DPT vaccine and TT vaccine is given, and it is also repeated in 10 to 12 years. Then there is also HPV vaccine given at adolescent age, 14 to 16 ages.
Wonderful. Now, personal question from you. How are you feeling with PD classes? कैसा लग रहा है आपको हमारे साथ?
Sir, it is very good, sir. I really love to attend your classes.
And what changes do you find in you?
It is. I have noticed that I have changes a lot after attending this class.
Okay.
I can speak. I actually improve my language skill, and I can answer it. If I attend to 3 or more classes, I can able to answer very well. It boosted my confidence.
This time we would have made a record that whomsoever have gone our student, they have cracked the interviews. But unfortunately, one of my student had suffered from dengue. Very intelligent surgeon he was, very intelligent. And he was from Pune, I think, but he suffered from dengue. Hardly 2 days, 3 days before. His interview was on 5th. And if he would have cracked, then we would have made a record that all our students have cracked the interview. See, there are other things then, like medical, they give time. But then they have merit also. They'll see the NEET PG, the result will come. It will take time. But regarding into, nobody fumbled at all. And everybody said, excellent, sir, super. Whatever they asked. Even if you don't know 1 or 2 medical also questions, but you have shown your confidence in speaking with other answers, they recruit, they take, they select. No problem at all. So if you give your answers in confidence, with confidence, and they see the dosage and all that, okay? Can you tell me about DOTS, DOTS? This question was also asked.
Okay, it is DOTS mean direct observed treatment, and it is given for tuberculosis.
Yes.
In that, the patient is scheduled to arrive at the primary health center or district hospital to get that medicine. It is to make sure that the patient taking that medicine properly under the supervisor of a nurse or doctor or ASHA worker. Then it consists of the treatment is consists of isoniazid, rifampicin, pyrazinamide, and ethambutol. and ethambutol. The total course period is 6 months or 12 months. It is according to whether it is multibacillary or paucibacillary. These medicine are first is the interventory period, and it is given for 2 months, and the second phase is the maintenance phase, and during this time the isoniazid, rifampicin, and ethambutol is given for 4 months.
Okay. Tell about hernia. This question is also asked many times.
Hernia means it is due to the weakness in the abdomen. There will be the protrusion of the abdominal contents, either the intestine, mucus diverticulum, lumen, that protruded from the abdomen within the due to weakness in the wall. There will be no pain or like that. There will be there is a lump, lump in the abdomen or inguinal region, and the treatment is sometimes okay. The grading will be the on the initial period. The patient can make it like the retractive back, but if it is not happen, we have to do the hernial repair should be done. It is done by a mesh repair. Nylon mesh is fixed in the abdomen, and then it is covered and packed. Sir, I am not audible, sir.
Tell about preeclampsia.
Preeclampsia. Okay, it is an emergency or life-threatening, not it is an emergency situation in during pregnancy period. Preeclampsia means there will be increase in BP greater than 140/90 mmHg after the 20 weeks of gestation, and normally it will get into back within the 20 weeks after delivery, and its main its pathophysiology is due to the a problem in the spiral arteries. The spiral arteries normally get vasodilated in pregnancy period for getting blood to the placenta, but in certain circumstances, it will not get vasodilated, and it will lead to increase in blood pressure, and the patient will be present with blurring of vision, headache, then increase in vomiting, etc. Then there will be proteinuria associated with preeclampsia. The proteinuria is greater than 0.3 gram or 300 milligram of protein or albumin in urine. And if the patient is also present with seizures, we call it eclampsia. If the preeclampsia is only have mild symptoms like that, there is no need for admission of the patient. If it is moderate severity, then admit the patient, give IV fluids, then oral nifedipine, oral alpha-methyl dropa or nifedipine hydralazine is given. Then okay, in its the ultimate treatment is the termination of pregnancy. If we can terminate it, if it is in moderate cases, it is terminated on 34 weeks. Or if there is present with severe symptoms, we can terminate. The definite treatment is termination of pregnancy. If we have time, we should give corticosteroids and then terminate the pregnancy. If the patient is present with seizures, it is called eclampsia. For that, we should give magnesium sulfate. It is a neuroprotective, and it will prevent further seizures. And the dose of magnesium sulfate is we give at a loading dose of about 4 milligram per deciliter, and then maintenance dose is given.
Okay, one question was asked on 8th by board 3, which I didn't ask from one of my student whom I took interview. That was, being a medical officer in CSC, how will you arrange vaccination drive?
Vaccination drive, it means we are giving vaccine to a large population in a limited time. We can give it either the patient coming for PHC for vaccination, or we can done it at bus stands, railway stations, or like places where people gather, or even in home visit. We are doing it in MR vaccine, measles rubella vaccine, that is catch-up vaccine. We give vaccine to all the children without regarding the previous history of vaccination, whether they are vaccinated or not. We look for we decide a day and we vaccinate all the children in that area at that time.
Seizure with fever. Seizures with fever, differential diagnosis.
Seizure with fever, it is mainly seen in encephalitis, then meningitis. Sometimes in dengue, we have seizures. Then if there is any previous history of seizure, then it can happen if there is only mild illness.
Okay. What is the calorie requirement in pregnancy?
Calorie requirement in first trimester, we usually follow the same diet. There is no additional requirement of calorie. In second and third trimester, we require there is an increase of 350 kilocalories from additional requirement is required in postpartum, that is during lactation. For the first 6 months, we require an addition of 600 kilocalorie, and after that an addition of 450 kilocalorie is required.
Okay. Tell about Stevens-Johnson syndrome.
Stevens-Johnson syndrome, okay, it is a it is primarily rash happening due to an adverse effect of a drug that given. If the body surface area is less than 30%, it is called Stevens-Johnson syndrome, and it is greater than 30%, it will become toxic necrolytic syndrome. And if a patient comes with Stevens-Johnson syndrome, first we should look all over the body. There were rashes. Then the patient will in hypotension, airway, breathing, circulation, all are noted. Then IV fluids are given.
Okay. Tell about Murphy sign.
Murphy sign is seen in acute appendicitis. Okay, there will be Murphy point, and when we are drawing a line from umbilicus to anterior superior iliac spine, the point lies in the medial 2/3 and lateral 1/3 in the abdomen. And if we, in case of acute appendicitis, if we palpate deep to that area, the patient will have pain.
Tell about hypoglycemia.
Hypoglycemia means there is decrease in blood glucose level less than 56 milligram per deciliter, and the normal value is 80 to 120. The patient mainly presents with dizziness, headache, the unconscious, etc. For that, we should first check the blood glucose level. It normally it is most commonly seen in patients who take insulin on a regular basis, so that their glycemic level can decrease at any point if they are skipping the meals, etc. For that, first we should know why the patient is unconscious, whether it is known to be hypoglycemia or hyperglycemia. Both of these cases, the symptoms were similar in nature. So first we should check the blood glucose level. If it is less than 56 milligram per deciliter, then it is hypoglycemia.
Most of the students in our medical corps being asked, tell about which stream is your favorite. Then what is yours? This is a very common question they are asking, and then they are asking questions based on that.
I like surgery and pediatrics, sir. Most
Okay.
favorite.
Just now our student has told, sir, that gynae obst. So she was asked about ectopic pregnancy. So you are going to say about pedia?
Yes, sir.
Pedia and surgery?
Yes, sir.
Okay. Polylithiasis and all these topics.
Okay, sir.
And although there are others also for surgery, CA breast, and even injuries like blast injury, all these pancreatitis, appendicitis, bowel perforation, gastric outlet obstruction, very important, or peptic ulcer for you, piles, BPH, okay, hernia and all these which I have asked already. Varicose veins, trauma, these questions are important for you. Pediatrics you stated, right? So they can talk about pneumonia also. Fever with rash, epilepsy. Okay, go with these topics.
Okay.
So come up in the video call, we'll talk.